Yeah, well, I tell you, if I feel like I'm catching a cold, my dose, now I've been taking big doses, my dose is 6 grams every 15 minutes and tell diarrhea. I mean, this diarrhea is not really diarrhea, it's just a soft stool, you know, if you have one soft stool, so big deal, what else is new? So when the disease comes, I just take it and take it and take it until suddenly you feel, oops, it's going to come, you see, and then you slow down and then back off of it. But the quicker the better, because if you can get saturated with the C, and in the case of a cold, you're trying to get your nose and throat saturated with the C, is you want to saturate it before this inflammatory cascade really gets going. See, the thing is that if the free radicals remember when the body makes free radicals because the body is damaged, these free radicals do more damage and cause more free radicals, and so there's this free radical cascade. So that if you hit it hard and fast at the very beginning, that's the best.
So 6 grams every 15 minutes, and you'd usually have that go on.
Yeah, well, it's the average person who's not had vitamin C before, I'd say 3-4 grams every 15 minutes.
For possibly a couple hours, or?
Yeah, or whatever it takes. I mean,
just to give them a basic idea of what they're looking. Is it going to be 3 hours?
Well, it depends. Well, see, they're 30-gram colds and they're 150-gram colds, so it sort of depends upon the epidemic. The one that's currently going around now, it's about 150 grammer. It's a bad one, and without the C, it results in a little bit of a bronchitis. And I don't know, other people are getting pneumonia. I haven't heard about that, but I've had patients come in who didn't take enough C, who are having a little bit of a bronchitis. It's interesting, this particular epidemic doesn't cause too much coughing, but you can feel it in the chest. And but anyway, hit them hard and fast. And as I say, as far as I can tell, there's no toxic dose of ascorbic acid as long as you're taking it with water. See, I don't want anybody to be taking huge doses of ascorbate if they're dry. Now, to give an example, I had one person years ago who had a fungal infection and was given 2 antibiotics by the infectious disease people that made him so sick that he wasn't eating or drinking. But he observed that when he took about 6 grams of ascorbic acid every hour, pretty much dry tablets, that he felt so much better. And so he did this for 3 or 4 days, and his kidneys shut down. And so then when they rehydrated him and he was off the ascorbate for a few days, fortunately it got the yeast and he's perfectly okay. The kidneys had absolutely recovered. And the theory was that it was oxalate kidney stones, oxalate crystals, not stones, but crystals. And so out of 30,000 people, this has happened only once. And this guy was one of the biggest vitamin C takers I've ever seen. And that's why, and it was under unusual circumstances. So that's why I'm saying when you take ascorbate, make sure you do not become dehydrated, because this might happen.